by age, but not of months. And rather than fixing those tests, what we are doing is we are going back and looking at data. So if I have to define that what test should be done at the age of 50, I don't tell that. I go and see the data of millions of people who have been 50 years old and what have been their diagnostic and what are the latest diagnoses coming. Based on that, we decide that because there is the latest diagnosis coming here, these are some of the tests that should be added as a mandatory test for 30 years. And things post-COVID, like ma'am just said, has changed. So a lot of this, supposedly, if I have to get a system test or something which is say a cardiac sort of a marker, probably it was there in 40s and it was not there in 30s. The last few episodes that you have seen all over, it has now come in 30s. So all that is how the test is. And the test is not only defined by age, it is also defined by a lot of habits that you have, a lot of lifestyle you have. Right? It is also defined by are you living in north or you living in south, because we know the food habits. So all of that changes. Based on that, you can select your
important question that how can I as a layman be sure that I'm getting the best thing. So for that there is an unorganized sector and there is an organized sector, and there is an accreditation check. So like the way if you go shopping, or let's say tomorrow the ladies here go shopping for gold, they will look for that mark that is this certified. So similarly in healthcare, thankfully we have a mark, right? So we have a NABL and a CAP mark, we have a ISO mark. So the layman, any layman can actually look at that has this lab gone through this checkpoint. Because me saying I'm good is not okay. Somebody else has to say I'm good, right? So that thankfully is there. So you can be assured that nothing is happening wrong. Everything is checked by a lot of people and who are not at all with they have no bias, or they are not under risk. So that standard is there. So as far as the organized healthcare sector is concerned, whether it's the hospitals or the laboratories, everybody is following a rule book. So nobody is breaking those ethical rules or the scientific rules. And then yes, within that you will have a speciality to focus on. So if you go to any hospital, they'll be famous for 2 or 3 things. Similarly, every lab will have its own strengths. So that is of course, it's your expertise and what have you spend more time over, what do you have more data over, where do you have more follow-up, where do you have more outcomes, publications. So all of that is there. Yeah? Just try and be normal. But yes, what is required to be done is required to be done, right? So for example, if you are pregnant, you have to do a test to know whether the child is going to be normal or abnormal. So there are certain things which have to be done. Similarly, if you are crossing the age of 40, you obviously need to check, your cholesterol, other things. If there is a family history of cancer, you need to check whether you are predisposed to it. So there are some basic things which one has to keep in mind, but there is no need for us to get excessively worried about it. But one thing I would advise, since I am an oncopathologist, stop smoking if you are smoking, because it's not only lung cancer, because there are 14 kind of cancers that it causes, right? So these are some things like, similarly liver disease, we've seen so much predominance again because of alcoholism. So moderation, everything is fine. I'm not saying stop drinking, but don't become an alcoholic. So just simple things.
The technology is evolving. It tells you, but it's very generic information. Doctor is more understanding. He knows your situation. If you feel something is not good with you, report it. Don't keep it within yourself. Be it a headache, or be it your shoulder pain. It can be frozen shoulder as well. Something can go wrong with you. Don't underestimate any symptom which your body is telling. Report it to doctors. Get it checked. Get it diagnosed. Get it treated. It is very important.